Perhaps as many as 32 million Americans will now have access to health care coverage as a result of Congress's action last night. I want to tell you a little bit about one of the families that will be affected by this. It's a young woman who at age 17, and I'm changing a few of the details to protect people's privacy, but the essentials are the same. A young woman who at age 17 was diagnosed with multiple sclerosis. At age 17, she was given, if not a death sentence, certainly a sentence for a short life. Imagine a young person at that point, a person full of dreams, a person full of hopes, a person full of promise, being given that terrible diagnosis. Her parents are friends of mine. I have known them for more than 40 years. It is their only child. Fortunately, and I didn't know this at the time, fortunately there are medications these days which are able to hold back the progress of this terrible disease. And so for the last 4 years, this young woman has had a nearly normal life. She has gone to college, she has done well, she is coming up on her college graduation. That should be a time for celebration. That should be a time of joy. That should be a time to celebrate the beginning of a new life and a new career. But for her family, it has not been that. Because this life-saving medication costs $30,000 a year. And her parents, bright, hard-working people, both college graduates, they have not been involved in professions where they have made a lot of money. $30,000 a year is not something that they can afford out of their pockets. And as she comes up to her college graduation, what they are facing is the fact that when she graduates, she will come off her father's health insurance. And they have no way to pay that $30,000. The young woman is completely, under the current regime, completely uninsurable because of the pre-existing condition. A young woman facing that kind of thing, coming up on her college graduation, and not in a celebratory or joyous mood as she should be, as every young person would be, but facing fear. And the parents facing fear of how they can possibly provide this life-saving medication to their daughter. How many times have we heard people say, "I'd give anything for my kids. I'd do anything for my kids." Well, what do you say to parents who would give everything and it wouldn't be enough? That was their situation until last night, when the Congress of the United States passed health care reform. And because of that action, and when that bill is signed tomorrow, she will be able to continue at least for 4 or 5 more years on her father's health insurance. And when she has to come off of that, she will be insurable despite her pre-existing condition. The Congress of the United States last night reached down and lifted up this family and gave them hope and gave them a future. I thank every member of our delegation who supported that bill. I look forward to its signing. It will be a joyous day for them and for all Americans.